happen is we'll turn that into a bottleneck at our small systems, kind of lead to delays in care, possibly poor outcomes.
Substantial cuts to Medicaid are now a reality following the passage of the president's big, beautiful bill. Tonight, our Ben Brown continues to investigate this decision, shining a light on rural healthcare workers and the profound impact these changes will have on the hundreds of thousands of patients they treat each year.
Right now, I'm just extremely disappointed. I feel like our message wasn't heard.
Now that President Trump's big, beautiful bill has been signed into law, concerns are growing about the potential impact on the nation's healthcare system, specifically rural hospitals like the one in Benson.
With the reduction in Medicaid state-directed spending, we're going to see a lot of people become uninsured.
When people become uninsured, they turn to the emergency department for treatment. With changes to Medicaid, like work requirements and eligibility tightening, hundreds of thousands of people are estimated to lose their coverage in Arizona.
What we're worried will happen is we'll turn that into a bottleneck at our small systems, kind of lead to delays in care, possibly poor outcomes. Because where I work, for sure, we'll see an increased strain on our system.
Rural hospitals tend to have larger Medicaid populations.
We also have to bear the brunt of that cost. So it's going to have a huge financial impact on uncompensated care for all hospitals.
Because their operating margins are so small, healthcare advocates say rural hospitals are the most at risk.
Most hospitals in the rural parts of Arizona operate between a 2 and 4% operating margin. By the time all of the cuts get phased in, which is about 6 years, we're looking at hospitals operating at a negative 8.5% operating margin, which is just not sustainable.
To try to make the numbers work, some facilities will have to start looking at services to potentially cut.
So that we can remain financially viable because of the impacts of this bill. There's things that we do that are kind of break even or really don't make a whole lot, but they're so critical for our population.
Services like the cardiac rehabilitation program.
Gotta get that heart going.
Or the diaper bank.
If you don't have diapers, you can't take your kid to daycare. And if you can't take your kid to daycare, you can't go to school or you can't go to work. So having this here gives people that little extra assistance that they might be able to use to make their situation better. And not having a service like that worries me.
Helena Whitney with the Arizona Hospital and Healthcare Association says at this point it's impossible to say which hospitals will close in Arizona, but we've seen the situation play out before.
You can equate this work requirement and the additional administrative burdens around the work requirements to the childless adult freeze that started back in 2011. The same effect is going to happen. People will lose their access coverage. There were some hospitals in the state that tried to hang on, but they were never able to financially bounce back from the revenue loss, and eventually they closed.
For now, it's business as usual at Benson Hospital. No cuts have been made, but they're bracing for what's next. Ben Brown, ABC15, Arizona.
The Trump administration believes the cuts to Medicaid will root out waste, fraud, and abuse. Some healthcare advocates we spoke to noted that Medicaid could benefit from some tweaks. However, they believed that this was the wrong approach.